Hello, my name is Jessica. I'm going to be your student nurse today. I'm going to be doing a full advanced assessment, head to toe assessment on you. If you have any questions throughout the assessment, just let me know, okay? Can you tell me your name and date of birth?
Kim Dukes, 7/14/83.
Can you tell me where you are?
Madison.
Okay. Can you tell me the President of the United States?
Donald Trump.
Okay. Patient is alert and oriented times 3. Do you have any allergies, especially specific to latex?
No, ma'am.
Okay, patient has no allergies. Okay, first I'm going to start by assessing your vital signs. So I'm going to take your blood pressure. Patient's blood pressure is 122/80. Okay, now, are you in any pain today?
No, ma'am.
Okay, patient says no pain. I'm going to check your radial pulse for 30 seconds. Okay, radial pulse is 80. It's a regular rhythm and it's a 2+, and I would assess this bilaterally. I'm going to go ahead and assess your brachial pulse. The brachial pulse is a 2+, and I would assess this bilaterally. Okay, I'm going to assess your skin. The patient's skin is warm, dry, intact. No presence of lesions or masses noted on the skin. I would also assess the patient's respirations, and they are 16, even and unlabored. No use of accessory muscles noted. Okay. Now moving on to your head. The patient's head is normal cephalic, symmetrical to the body. It is the appropriate size for the patient's body. Can you turn your head to the side for me? To the other side. Patient has good control of her head. Now I'm just going to look at your hair. The patient's hair is the appropriate color for age. It's evenly distributed. I'm just looking at the scalp. The scalp is white, dry. No lesions are present. So I'm going to check behind the ears and at the base of the neck. I do not notice any nits or any type of lesions. All right. At this time, I'm going to check your skin turgor. No tinting noted with skin turgor, and I'll assess your capillary refill. Capillary refill is less than 3 seconds, and I would assess this bilaterally. Okay. I'm going to feel your temporal artery. The temporal artery is a 2+, and I would assess this bilaterally. I'm going to put my hands on your face to assess your sinus, okay? First, I'm going to assess the maxillary sinuses. Do you feel any tenderness?
No.
No tenderness noted in the maxillary sinuses. I'm going to feel your frontal sinuses. Any tenderness noted?
No.
No tenderness noted in the frontal sinuses. Okay. I'm going to have you to open your jaw for me. Okay, can you bite down, clench your teeth? Okay, no decrepitness noted in the temporal mandibular joint. Cranial nerve 5 is intact. Can you smile for me? Frown. Can you raise your eyebrows? Can you blow out your cheeks like a blowfish? Okay. Cranial nerve 7, the facial nerve is intact. Okay, now moving on to the patient's eyes. The pupils are round, symmetric, and a size 3. The external structures are intact. The eyebrows and eyelashes are evenly distributed. I don't see any lesions or any drainage on the eyes. The sclera of the eye is white. I'm going to put on your eyes. The conjunctiva of the eye is pink and moist. Okay, I'm going to have you to look past my shoulder. I'm going to be checking direct and consensual response. Okay, direct response is intact. Cranial nerve 3 is intact. Now I'm going to shine the light in and look at the opposite pupil to see if it can stretch. Okay, consensual is intact. Cranial nerve 3 is intact. Okay, now if you'll just look past, I'm going to have you to follow this light, this pin. Pupils are indentation is noted. Cranial nerve 3 is intact. If you'll follow this light for me, don't move your head. Okay, cranial nerves 3, 4, and 6 are intact. Okay, now moving over to the patient's ears. I'm just going to touch your ear. Tell me, does that feel tender?
No.
Okay, no tenderness noted on the ear. I'll assess this bilaterally. No lesions are present on either ear. Okay, now I'm going to look into your ear canal. The ear canal is free of lesions and exudate. No drainage noted. Okay, I'm going to use this otoscope and I'm going to look in the patient's ear. The tympanic membrane is translucent, pearly white, and shiny. No drainage or exudate noted, no lesions present, and I would assess this bilaterally. Okay, I'm going to stand behind you. I want you to cover up your right ear. I'm going to whisper something in your ear, and I want you to repeat it for me.
Today is a beautiful day.
Okay, I would assess this bilaterally. Cranial nerve 8 is intact. Okay, now moving to your nose. The nose is symmetric to the face. The nasal mucosa is pink and moist. No drainage, lesions, or polyps are present. The nasal septum is not deviated. The ears are also symmetrical to the patient's face, and they are the appropriate size for the patient's face. Okay, now I'm going to look at, if you close your eyes for me, and I want you to cover one nose, one nostril, and I'm going to have you smell something, and I want you to tell me what you smell. Okay?
Alcohol.
Okay. Cranial nerve 1 is intact, and I would assess this bilaterally. Can you cover one nostril? Breathe in for me. Do the other side. Okay, the nares are patent. Now I'm going to move on to your mouth. Okay, the external structures are intact. The gums or the lips are pink and moist. Okay, open your mouth for me. Okay, the buccal mucosa is pink and moist. No lesions are present. The soft and hard palate are intact. They are pink and moist. No lesions are present. The tongue is pink, moist, and rigid. Can you raise your tongue? Vesicles are intact. No lesions present. 28 healthy teeth are intact. I do not see any cavities. Can you stick out your tongue and say "ah" for me? Okay, the uvula moves midline of bone formation. Cranial nerve 9 is intact. The tonsils are a grade of 1. I do not see any lesions, exudate, or white patches on the tonsils or in the throat. Okay, can you stick your tongue out for me and move it side to side? Okay, cranial nerve 12 is intact. I'm going to go ahead and have you swallow for me. Okay, cranial nerve 9 and 10 are intact, and the trachea is not deviated. Can you pull down your lip for me? Okay, the gums are free of lesions. There is no bleeding noted, and they are moist and pink. I will assess the upper lip also. Okay, now moving down to your neck. Can you turn your head to the side for me? No jugular vein distension is noted. No palpations are noted. I do not see any lesions or masses on the neck. I'm going to assess the carotid artery. The carotid artery is a 2+, and I would assess this bilaterally. I'm going to check the range of motion in your neck. Can you put your chin down for me? Okay, lift your chin all the way up. Okay, put one ear to your shoulder, other ear to your other shoulder, and move your head in a full circle. Okay, full range of motion noted in the neck. Okay, can you push your hand against my face? Okay. The muscle strength in the neck is noted out of 4. Okay, now I'm going to have you go ahead and shrug your shoulders for me. Cranial nerve 11 is intact. Okay, so now I'm going to assess your chest. Do you feel any tenderness in your chest? No tenderness is noted, no masses or no lesions are noted in the chest. Okay, I'm going to assess your breath sounds, okay? Breath sounds are clear bilaterally on the anterior chest. No adventitious sounds are noted. I will now assess the posterior breath sounds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 6, 6, 7, 7, 8, 9, 8, and 9. Posterior breath sounds are clear bilaterally. No adventitious sounds are noted in the breath sounds. Okay, the chest is symmetric. It's a ratio of 2 to 1. Okay, now I'm going to listen to your heart, okay? The first part I'm going to listen to is the second intercostal space, the right sternal border. It's the aortic valve. Okay, now moving over to the second intercostal space on the left sternal border, I will be listening to pulmonic. Moving down to the third intercostal space, left sternal border, I will be listening to Erb's point. Down to the fourth intercostal space, left sternal border, I will be listening to the tricuspid valve. Now moving down to the fifth intercostal space, mid-clavicular line, I will be listening to the mitral valve, also known as the patient's apical pulse, and I will listen to this for 1 full minute. Okay, the patient's apical pulse is 80. It's a regular rhythm and it is 2+.
What?
Okay, S1 and S2 noted the heart sounds and no murmurs noted. Okay, now I'm going to assess your arms. The arms are symmetric. I don't see any lesions on the arms. The skin is one round intact on the arms. Okay, you're fine. I'm going to assess the wrist. Can you raise your wrist up, put it down, move it side to side. Okay, full range of motion in the wrist, no decrepitous, no in the joint. Okay, if you will put your elbow up, put it down, move it in and out. Okay, full range of motion in the elbow, no decrepitous, no in the joint. And if you will you stand up for me? Okay, will you raise your arm all the way up, put it down, cross it in front of your body, and put it behind your body. Okay, full range of motion in the shoulder, no decrepitous, not in the joints. I would assess the shoulder, the elbow, and the wrist bilaterally. Okay, if you'll set that down for me. I'm going to assess your lymph node this time. Preauricular, posterior auricular, occipital, posterior cervical, superficial cervical, the deep cervical chain, supraclavicular, jugulo-digastric, and I'm going to assess your epiclavicular this time. The lymph nodes are non-palpable, no tenderness noted. Okay. Can you do this for me? Okay. Fine motor skills are intact. Okay. I'm sorry, but could you stand back up for me again? Okay, I'm going to check abduction and adduction. If you will stick your leg out and bring it back in. Okay, and just kind of move your leg in a circle. Okay, full range of motion is noted in the hip, no decrepitous noted in the joint. I would assess this bilaterally. Okay, can you bend your knee up? Okay, kick your knee out. Okay, full range of motion noted in the knee, no decrepitous in the joints, and I would assess this bilaterally. I'll keep it down for me. Okay, can you bend your ankle up? Okay, put it down and move it in a circle. Full range of motion in the ankle, no decrepitous noted in the joints. I would assess this bilaterally. Okay, now I'm going to test muscle strength. Can you grab onto my fingers, squeeze? Okay. Muscle strength is noted under 4 in my hands. Okay, put your arms up for me. Okay, push against my hands. Now pull. Okay, and muscle strength is a 4 in the arms. Can you keep me from pushing your legs down and from pulling them? Okay, muscle strength is a 4 in the legs. Okay, keep me from pushing your foot down and from pulling up. Okay, muscle strength is a 4 in the ankles, and I would assess this bilaterally. Okay, now I'm going to assess your reflexes. Okay. Okay, reflexes noted in both legs. Okay, to, ask you to lay down for me. I am going to assess your, abdomen. The abdomen is flat. I do not notice any masses, lesions, wounds, drainage, or anything of that nature on the abdomen. When was your last bowel movement?
This morning.
Okay, is it normal for you to have bowel movements every day?
Yes.
Okay. Has there been any changes in your urination? Any frequency, urgency, incontinence episodes?
No.
Okay, patient states no changes in bowel or bladder habits. I'm going to take a listen to your abdomen. I will start in the right lower quadrant, right upper, left lower. Okay, bowel sounds are normal, active in all 4 quadrants. If they were not, if they were hyper or hypoactive, I would assess them, or if they were hypoactive, I would assess them 5 minutes in each quadrant for a total of 20 minutes if they were not present. Okay, now I'm going to feel your belly. Does that feel tender?
No.
Okay, no tenderness noted, no pulsations noted, and the umbilicus is indented. Okay, now I'm going to look at your legs. There is no hair present on the legs. If there was, I would check for distribution. No edema noted in the legs or the ankles. I don't see any lesions or masses or any kind of abnormalities on the legs. Okay, you can sit back up for me. Okay, and a couple of lymph nodes that I forgot to assess earlier are the submandibular and the submental, and there is no, there's no tenderness noted, and they are non-palpable. Okay, so now I'm going to assess your pulses on your legs. Alright, I'm going to check the popliteal. It is a 2+. I'm going to check the posterior tibialis. It is also a 2+. And I will assess the dorsalis pedis. It is also a 2+. I'm going to put on gloves and I'm going to look at your foot. Okay. The patient's foot is, the skin is dry and intact. I don't see any fungus between the toes or on the nails. The nails are evenly clipped. The bottom of the foot has no calluses, cracks, or lesions present. I would assess this bilaterally. Sorry, ma'am. Okay, I would also assess the popliteal, the dorsalis pedis, and the posterior tibialis. I would assess all of those